Hi guys, welcome back to the channel. Thank you for joining me. Okay, so there was a guy called David Crompton who you may have read in the news already. He unfortunately he died after falling down the stairs where he received a brain injury and then had a cardiac arrest. Now the reason why I'm talking about this particular case is because this guy David Crompton had been trying to get epilepsy medication from his pharmacy, and apparently he had gone 10 days without his epilepsy medication. Now the coroner inquest said that they believed that 10 days without his medication would have caused a seizure, which likely led to him falling down the stairs and unfortunately passing away. And I think it's becoming more and more common, certainly for my wife. I've noticed now that more and more medication is having to be ordered. It's not available. Sometimes we have to wait 2 or 3 days for medication to arrive. Now my wife is very good at trying to order medication before she needs it. However, I don't know whether it's like with you guys, but certainly with our guys, with our surgery, with our doctors, they won't prescribe you too far in advance. You have to have a certain amount left before they will order the next prescription. So you can't just order it when you need it. You have to have a certain amount of time gone by before you can order again. So there is a window where you have to order your medication either because you're going to run out. And the trouble is, I've noticed lately, there's less and less medication being available at the pharmacy. Now the coroner has said that he believes that it was wrong for the pharmacy to then say to him he's got to go and find this drug at another pharmacy. He believes that the pharmacy should have gone on and asked around to see if they could get supply of this drug. And again, it varies, I think, between pharmacy and pharmacy. Some pharmacies I've known have rung around to other pharmacies to ask if they've got stock in, or they have an online system where they can check within their group of pharmacies if others have got that medication in stock. But of course, it doesn't happen everywhere. And I think there needs to be some kind of uniform standard. It needs to be some kind of way where drugs like these can become available and be available better. And certainly the Epilepsy Foundation have said that they are very concerned about this. They've been telling the government for months that the drugs aren't available. The distribution, the availability of these drugs is very difficult, and people are waiting a long time. And she's called on Wes Streeting to try and help the situation. Now, it doesn't say that the government have responded to this, and I know that the government are working to try and get the NHS in a better situation, but they're also calling on pharmacies to do more. And I'm wondering whether this is causing even more pressure on pharmacies. They've now got so much more to do. They're now dealing with so many more patients than they had before, because a lot of the patients that doctors would normally see are now being diverted to pharmacies. And on top of that, you've got this shortage of medication. Now, of course, this isn't necessarily the pharmacy's fault, but surely the NHS can start to work on this and get more of the medication that people need, especially epilepsy medication and things like that, to make sure that it's available at least within a day or two, rather than having to wait 10 days as this poor guy did. But let me know down in the comment section what you think, whether you've had trouble getting hold of your medication, because some of it is, it's life-saving medication, and if you don't have it, then the repercussions can be, well, like this guy had, I guess. So let me know down in the comment section what you think, whether you've had trouble getting medication from your pharmacy. I would love to hear your thoughts on that. And while you're here, if you've got this far, don't forget to subscribe if you like this content, or if you like what I talk about on here. I talk about DWP and disabilities, mental health, that kind of thing as well. And I'll see you next time.